Scientific studies show that epidural is the best pain relief method during labor and delivery. If you're pregnant and wonder if you should take epidural, we have studies that you might be interested in listening to. We'll talk about several studies with the research being conducted globally, including Tameside Hospital, the University of Manchester, Women's and Children's Hospital Adelaide, Keele University, University of Groningen, and Chi Mai Medical Centre. All these studies can influence your decision in taking epidural. Traditionally, high concentration of drugs is used to relieve women of labor pain. The result? Leg weakness, poor mobility, and difficulty in giving birth that can result in instrumental intervention, for example forceps. But modern technologies and techniques have reduced the need for such intervention. Another improved method of combined spinal and epidural drugs were introduced as a quicker way for pain relief. A study in 2012 involving over 3,000 women showed that there is no difference in pain relief between the two treatments. However, itching is a known side effect of combined spinal epidural analgesia or drug, with an incidence ranging from 41.4% to 44%. So, getting only epidural may stop you from itch or pruritus. You can also get the option of opioid injection instead of epidural. Based on a study with 11,000 women, epidural does not have any effects on the baby at birth. However, it can cause you fever and urinary retention. You might lose your mobility for a bit and might experience longer labor. Your hospital might also offer patient-controlled drug, a drug with a delivery method where you can control whenever you want to take it by pressing a button. Based on a meta-analysis of 619 women, women who received epidural were more likely to have emergency delivery, compared to women who had patient-controlled drug. However, take this with a grain of salt since a lot of factors can influence labor progression. You might also hear that epidural can cause back pain. A study in 2002 showed that the presence of persistent pain, long-term pain, and low back pain were common in women who received and did not receive epidural. The study, that is based on 369 women, showed no association between epidural and low back pain. You might also hear that there is an increased risk of autism if you get the epidural. A meta-analysis involving over 4 million children only showed weak evidence, so it is not conclusive that epidural causes autism. The use of pain relief is on the rise among women in labor. In France, the rate of epidural in 2022 was 80% as compared to 4% in 1981. In the US, it's 67%. In the UK, the epidural rate is decreasing to 60% in 2022 from 70% in late 1990s and early 2000s. Some countries tend to recommend epidurals, like Finland, Sweden, and Spain, unless there is a medical reason not to do so. Talk to your healthcare provider about the options, the benefits, and disadvantages of each before you make a decision. We have also compiled an information pack on epidural, including lists of alternative pain medications that you can take during labor. Link in the description below. Knowing what to expect and understanding your options will definitely help with your pregnancy journey. Let us know in the comment what you think of epidural. Would you get it? If not, what kind of pain relieving treatment would you go for? If you know anyone that is pregnant, feel free to click the share button and send it to them. If you yourself are pregnant, watch other videos on our channel to feed your brain about pregnancy. Also click the subscribe button so we can keep you up to date on the science of pregnancy.